So, morning everyone. First part, I was just going to show some slides, some typical ultrasound images that I take, even if it's a normal appearance of that particular region of the neck, that I would take an image of, just say that documents that's normal. And we'll go through just some of the anatomy so you can orientate yourselves. Okay, so you're going to go and then at the end, I don't know if any of you kind of document or formally record anything in patient notes about what you've seen, but I've just show you my template for normal, just as an example. Okay, so if we go to the next slide. So as a radiologist, we generally start a diagnostic scan in the center of the neck, underneath the symphysis menti. And at that point, we're looking at lymph nodes in the level 1A region, and scrolling back, and we can see the floor of the mouth. So, and we just take the probe back in the midline to the hyoid. So what might that look like? So get the next slide. So this is your typical ultrasound appearance. So here you have the mylohyoid muscle, which forms obviously the floor of the mouth, anterior belly digastric muscles. Beneath that, that's your genohyoid and then your genoglossus muscles. And then either side of that, you have your sublingual glands. You want to notice like it's very uniform echotexture to the sublingual glands. Okay, that might be important in some of the talks we come across later this afternoon. Hint, here we have the mandible. So again, you can see that you've got the cortex there, reflective cortex, and then you're just seeing shadow behind it because all the sound beams are reflected back towards the probe. So that's what you want to be seeing when you're practicing in your session later. Okay, so next slide. And then as you come back a bit further, you're starting to come towards the hyoid. So again, anterior belly digastric, starting to see the hyoid here, mylohyoid and the genohyoid muscles in the back of the tongue is here. Okay, and obviously all this is just subcutaneous fat beneath the skin. Okay, next slide. So then the second part of reviewing is the midline is below the hyoid, so into level 6, and basically I scroll down and I'm looking, following the strap muscles. I'll come across the isthmus of the thyroid in the center, and then down in towards the jugular notch, looking for kind of level 6 lymph nodes. So next slide. So typical image. So take one of the isthmus, and then what you can see is on this side you can also see the majority of the thyroid lobes. You can just see here there's a bit of a ring here. This is the esophagus, you can see, and then you've got the longest colli muscles at the back here, and this is the vertebral body here. And you can see that a lot of the sound waves bounce off the tracheal rings and go back towards the probe, so that's why you're getting this hyperechoic band here, and then you're getting this reverberation kind of artifact, and then sort of some shadow behind. So kind of looking at the trachea, you don't really see much. Okay, and then you've got your infrahyoid muscles just at the top here. So next slide, please. So again, just coming down towards level 6, starting to see the common carotids. Here again, trachea, longest colli muscles at the back here, infrahyoid muscles, starting to see a bit of the sternocleidomastoid muscle coming in towards its insertion towards the sternum and the medial end of the clavicle. And then next slide. Next one. So once I've done that, then I want to look at the thyroid lobes individually. Okay. So at this point, what I do is I also calibrate the color Doppler. So on the machine, you can change the gain. So then the idea is that when you put the color on, that the color remains within the wall of the common carotid. So you place the probe over the common carotid. Why is that important? Well, if your gain is too high and you can see it flaring outside the walls of the carotid, when you're looking at a thyroid nodule, you can induce central vascularity and would give you a U3 category. But if you were to calibrate it, that probably would not be there. So it could be induce an artifact, and you could give someone the wrong U grade of their thyroid nodule. So can you go to the next slide? So I tend to start at the top and scroll down. It doesn't matter as long as you, whatever your routine is, you stick to it so you don't miss anything. So take an image from superior pole, mid-thyroid and inferior pole. And you can see here that calibrated, so you can see that this is what you should be seeing, that the colour Doppler is within the walls of the common carotid. And again, look at the echo texture of the thyroid, how uniform it is. Again, so that's what normal looks like. Okay, and again, you can see some of the transverse process of the cervical vertebrae. You're seeing a bit of the trachea here, and again, some of the prevertebral muscles, infrahyoid muscles, and sternocleidomastoid muscle. Okay. And next one, please. And then sometimes if I see something, I'll do a longitudinal view. So I just, instead of having the probe horizontal, I'll put it vertically. I just have a look and scroll through. So sometimes you see internal vascularity when it's vertical, and then you don't really see it when it's transverse. So it's just always worth having a sweep through. When we are measuring thyroid nodules, we're just using the transverse position of the probe to measure the anteroposterior dimension and the transverse dimension. We don't measure the cranial caudal length, and that's something that some of our radiology trainees end up documenting when they first start doing these things. You can also see them quite nicely, intervertebral discs, especially if they're young patients, and then these are individual vertebral bodies that you can see here. Okay. Next slide. And again, once you've done the right side, you do the other side. So, same thing. Okay, next slide. Next slide. So once I've finished interrogating thyroid, I return to the superior part of the neck, and I'm going to look at the level 1B region, so looking at submandibular gland, submandibular duct, level 1B lymph nodes, and essentially put the probe on and just kind of scan from mandible down. So what does that look like on ultrasound? Next one, please. So here's your submandibular glands, partial voluming of some facial vessels, and you can see that this is the mylohyoid here muscle. The gland curves around the back. So just here you can see that anterior digastric, mylohyoid, and just the edge here you can see hyoglossus. And through this part here is where you'll interrogate to look for any kind of duct abnormality if it's dilated. Okay. So a bit better view of this. So just to orientate you, anterior digastric, mylohyoid, hyoglossus, and it's in this space here that you're looking for the duct. Normally you don't see it. Okay. All right. So this next slide. So sometimes the mylohyoid muscle can have a natural defect in it, and what happens is that the sublingual gland herniates through, and that has presented to us in the past for ultrasound as a mass within the level 1B region. So it's just something to be aware of, that these things do crop up from time to time. So what you're seeing here is, this is the defect here in the mylohyoid muscle, and this is the sublingual gland herniating through. But again, the echotexture is rather uniform, it's normal looking. Okay. And again, you can get smaller ones. They're all okay. Next slide. Okay. And if you're not sure, you can always put colour Doppler on it, and you can see some. Okay. Once finished interrogating the submandibular region, move on to the parotid region. So again, people's parotids vary in their size. Sometimes you can see all of it within the footprint of the probe. Sometimes you have to, do a routine, which is what I do. So I kind of go up the posterior border along the base of the gland, if you like, and then down the anterior border towards the tail. And then if I've not seen anything, drive through the middle of the gland parenchyma to make sure I've seen everything. Okay, so again, doesn't matter which order you do it in, back, top, front, or front, back. Sorry, front, top, back. Just as long as you stick to your routine so you know you've seen everything. So what does that look like? So for this part, I tend to drop the frequency of the probe, so make it a lower frequency so you get that deeper penetration, because you won't see the deeper aspect very well. So dropping the frequency enables you to see it better. So here we have the mandible here, this is the masseter muscle, and then this is the gland here. Again, make a note of how uniform the echogenicity of the gland parenchyma looks like in normal. Okay. So once we've finished with the parotid region, we then want to look along the internal jugular vein through lymph node levels 2 to 4, looking at lymph nodes essentially. And that's just make sure that when you're doing this, that your carotid and your internal jugular vein are in the center of the image. Okay, that it's not off to one side. Often when trainees start doing this, they don't do that. It's kind of off to the side, and they don't always see everything they need to see. So having that in the center helps you with your assessment. So if you just go to the next, what does that look like? So this is a normal looking lymph node, oval morphology, fatty hilum, measures 7 millimeters short axis. Then you've got the carotid sheath here, sternocleidomastoid muscle, and literally just scrolling through from top to bottom. So next one, I think we've just got these. So again, just scrolling through it. Lymph node here. So again, oval morphology, fatty hilum. Next one, and down to level 4. So how do you tell the difference between level 3 and level 4? Well, unless you want to go medially and look for, so you can see the cricoid cartilage, what we tend to use is the omohyoid muscle as it crosses the internal jugular vein. So we'll be able to show that better on the demonstration. So as the omohyoid muscle crosses the internal jugular vein and goes on its lateral border, that becomes level 4 as a rough estimate of where a lymph node might be. Above that, it's level 3. Okay. And again. So you can also see other things. With ultrasound, you can see most things in the neck. So with this, again, so here's your carotid and internal jugular vein. Here is your scalene anterior, and if you can see these 3 dots here, does anyone know what these might be? Here's scalene medius. Brachioplexus, yes, these are your brachioplexus trunks. Okay. So we try again, sternocleidomastoid muscle here. Okay. And if you're not sure, you can always put the coloured Doppler on, and that'll show there's no flow. Other things you can see, if you're so inclined. So if this is a longitudinal look through the neck, what you're seeing here is the transverse processes, the cervical vertebrae, and these are the vertebral vessels that you can see on the colour Doppler. Okay. Next one. So once we've done 2 through to 4, we then want to look at the posterior triangle, so your level 5A and B. And again, it's a similar process. So you want to have the posterior border of the sternocleidomastoid muscle and the anterior border of trapezius, either side of your image, and you're just driving through that posterior cervical space fat as you go down the neck looking for lymph nodes. So what does that look like? So right side, so that's here, sternocleidomastoid, trapezius, posterior cervical space, fat, and then you've got in the floor here, you'll have your levator scapulae and all the other muscles of the posterior triangle. Okay, so again, you're just looking in the fat here for the lymph nodes. Okay, Just scroll down again. So another anatomical variant. So sometimes the thoracic duct can be quite prominent in people when you're scanning the left level 4 region, and sometimes it has been mistaken for something abnormal in the past. But this is the thoracic duct here, jugular vein, common carotid, and if you just scroll down for me next, you can see that here's the thoracic duct. Keep going, and you can see that it's coming in towards the internal jugular vein. Next one. Oh, it's this. And it goes into the confluence there. Okay. So that's just something to be aware of if you're scanning. Oh, what's that tubular structure look? Okay. So if you just scroll down, so next. So I just put this in just to remind everyone. So obviously, when we're scanning, we want to make sure we use all the terminology that to communicate to one another about where abnormal lymph nodes are, and the next one. And then this is just my reporting slide. So this is what normal. This is what I would put on my ultrasound report if it was a normal neck scan. So it's just something to bear in mind when you're doing this in your own practice. Just think about having some formal documentation, because obviously the image, you can't take images normally if you're doing it in an ENT clinic, and it might be worth considering maybe, I don't know, having the ability to maybe print off an image to put into the patient's notes of something that you found, especially if you don't have the ability to put things through to packs so we can all look at it. People do different things. I've got a colleague that lies people completely flat to do the scan. I like to have them 45-degree angle, more or less, just because that's how I'm comfortable with. And then kind of like, I have them at like shoulder height in terms of just scanning. I tend to stand to scan anyway. Some people have a sit down. So first part is a start in the centre. So I ask them to lift their chin up and just look straight up at the ceiling for this first part. So, okay. So I don't know if you've... Yeah?
You just see the screen better then. Thank you.
There you go. How's that for everyone? See it? Yeah. So scroll back through level 1. So as you can see the mylohyoid muscle, genohyoid, genoglossus. As you come back, has this got an arrow on it? No. Vina, you're right to just maybe point to the screen, just like that.
So as Michael mentioned, we've got the anterior belly of the digastric muscles. You've got that a sling, the mylohyoid muscle. You've got the genohyoid, the genoglossus, and the sublingual glands laterally.
Okay. Then you just come back towards the hyoid. So as you come back, there's the hyoid there, that reflective structure. Yeah. And then you're down into level 6. So here you can see the pre-epiglottic fat.
Yes, that's epigenic fat over here.
And then you start to see now the paraglottic fat spaces with the thyroid laminae.
Yeah, so that would be the thyroid lamina here, and that would be the paraglottic fat, uniform and echogenic.
Okay. And then as you come down, increase the gain. Can you say your name, Susie?
Susie.
So there you go. So level of the glottis. Okay. And then come down. Need some more gel. So down thyroid isthmus. Okay, all the way down to level 6. Okay, so then I'll take an image here. Okay. So once we've done that, look at the thyroid. So on this machine, it's the C button that you hit, depress, and it'll bring up a box for you. And then what you can do is you can twist it either left or right. Left to reduce the gain, and to the right to increase it. So you can see how, if you've got the gain too high, you can make it flare. And so ideally, just change the gain so it's just within the walls of the carotid, and then just start at the top, the thyroid, and just scroll down so it's in the middle. You can also change the size of the box as well, which we can show you on the machines itself. So, can I talk about your colloid nodule? So, here you can see a tiny colloid nodule. Okay, and then just scrolling down. And then once I've done that side, move to the other side, and then just do the same thing again, just scroll down. So again, you can see colloid nodule with that reverberation artifact just to the, on the left isthmus there. Scroll down. So there we go. So sometimes, can you see to the left of the screen there, I've lost some contact. So you just need to adjust your probe position, just press down. Okay, because obviously the neck's not completely fat, just to get rid of that. Okay. There we go. So, take that off. So once we've done that, move to submandibular region. So what you can do is you can use your little finger just to rest on the patient's skin, just to steady your hand so you know where they are. So this is the mandible. So as we scroll down, level 1B lymph nodes, and then there's your submandibular gland there. So if we come anterior, you can see on the outer side there, the anterior below digastric, just below that top, up, that one. Then below that, monohyoid, and then higher glossus beneath that, and then between those two is your submandibular duct. So if I do that there, you can, it's probably better. So monohyoid, and then the band below it.
So that's a monohyoid here with the superior of the screen, and that's a hyoglossus. And the duct, you would normally see it coming out between these two.
Okay, so once happy with that, if you want to, you can put the colour on and you can see the facial artery there coursing through. Okay, so next one. So once we're finished with that, I want to do the parotid. So for this, I want to drop the frequency to low on this machine. So I'll show you what the difference looks like. So find the angle of the mandible and just put the probe just below the earlobe, and you'll be in the right place for that. So again, you can see the mandible and you can see the superficial lobe really well, and then as you look down, you can see some of the deep lobe. So if I change the frequency to high again, can you see how you lose that deep aspect? It's not, you can't really see it. If I drop the frequency again, you see it much better. Okay. So with this, you want to drive up the posterior aspect of the parotid along the top, and then down the front. And then if you're not sure, once you've gone all the way to the tail, just drive up through the center just to make sure you've seen everything. If you do see something like the duct and you want to have a look, you can bring the probe forward. So there's the zygomatic arch there, and as you come down, you can see the front of the mandible there on the left-hand side of the screen. And Then you come down. You can see you can see the teeth there. Look. Yeah. So you just be looking along this course, either for accessory parotid tissue overlying the masseter muscle, which is just there, and also looking for the duct as well. So, because Susie's normal, we won't do anything to worry about. So once we're happy with the parotid, I want to move through levels 2 to 4. So again, what you want to do is just below the angle of the mandible, stick your probe on so you can see parotid there. As you come down, so there's parotid. Come down, just the tail of the parotid on this is touching the back of the submandibular gland. So you want to have this posterior border of the submandibular glands to the right-hand side of the screen. Sternocleidomastoid is on the left-hand side of the screen, and you're looking just to scroll down. So there's a level 2 lymph node. If I just scroll back and forth, you can see how it pops in and out of the image as we scroll through. That oval morphology and that fatty hilum, which is bright. And scroll down with the vessels in the center, level 3, and then as we look, can you see omohyoid there? So that's omohyoid as it crosses. We're going from that level 3 lymph node there, because the omohyoid is medial to the vessels, to now we're into level 4 because the omohyoid is on the lateral aspect. Okay. So just follow that all the way down. Just pour some of that gel. So all the way down through level 4. And then that's the clavicle. That's the clavicle there. So once we're happy with that, can I just get you to turn to your left, see your head? So just the course of sternocleidomastoid, you just want to put the probe just at the posterior border of that. And so we just bring it forward. So sternocleidomastoid there at the top of the screen. So just bring that to the left-hand side. So there's your posterior cervical space where you want to be, and you just want to scroll down through there. So you're just looking for any lymph nodes. Just lost a bit of contact. And then once you've done that, you want to just scroll along the top of the clavicle to the midline, and then you repeat on exactly the same sequence on the left side. Okay. Any questions about the sweeps or anything?
Does everyone follow the same plan?
So as radiologists, yeah, as head and neck radiologists, this is what we do in our practice. Yeah.
Do you have to have a chaperone when you do it?
So we have a helper in all our rooms, yeah. So they act as a chaperone and yeah.
Are you prone to upper limb problems because your arms can't be bothered, isn't it?
So I have some sonographic colleagues who have shoulder issues, but that's why you want to adjust the patient to make sure you kind of prevent those, and making sure that you're not kind of scanning up like this or leaning forwards, that you have a pretty much a neutral body position. But obviously you do put pressure on your shoulder, repetitive strain. Yeah.
I know Jerry scans sitting down, doesn't he? The sonographer at the same side, he sits down, but it's still shoulder height, but he sits rather than stand.
It's just personal preference, what people do. I've started to stand up because I think I spend most of my working day sat. So unless it's it's one of the few times I get to stand up. So, everyone happy with the sweeps? Maybe we could start having a go, Jared.